Health and Wellness podcast brought to you by Sanford Health. The conversation today is about Alzheimer's and dementia, the importance of early recognition, the science behind memory loss, and clarify some of the common myths around these conditions. Our guest is Dr. Nicole Norheim, a clinical neuropsychologist with Sanford Health in Bismarck, North Dakota. Our host is Mick Gary with Sanford Health News.
As it applies to our conversation today, some things that people that you work with, patients that you have, and what your job is in this, how do you serve in this role?
Sure. So I'm a clinical neuropsychologist. So I have a doctorate in psychology, but extra training in neuropsychology. So my specialty is assessing, testing patients' cognition with a series of cognitive tests. And so that's my specialty. I'm actually lifespan, so I see kids to adults, but I know within the North Dakota population, we're really needed in the older adults and concerns with dementia. So with that being said, my specialty is going to look at cognition. We're going to look at, when I say cognition, memory, attention, language, visual spatial deficits, and see what those strengths and weaknesses mean. Is it a dementia? Is it normal aging? Or is there something else going on? And that's kind of what we do. We do an interview, testing, and then feedback.
All right. First question then. Could you explain the difference between Alzheimer's and other forms of dementia?
That's a great question. That is actually my most common question I get, especially during my feedback portions of my evaluation. So think about it as, actually, I'm going to say thinking is on a line. On the far left side is normal aging. As we get older, we're not as sharp as we used to be. We process information slower, but that's typical as we age. In the middle, we have a mild cognitive impairment. It's where people have a little more thinking difficulties, memory problems than normal, but they still can drive, manage medications, manage finances, cook, clean, no significant difficulties. But then on the other end of the spectrum, on the far right side, we have people with significant problems with thinking and memory, but now it's impacting their day-to-day. They're getting lost while driving. They're forgetting to take their medicine, forgetting to pay their bills, having more confusion paying their bills, burning things. And then the broad term is dementia. So dementia is a broad term. And so there's different types of dementia. Alzheimer's disease is a type of dementia. There's frontotemporal dementia, there's Parkinson's disease dementia, there's vascular dementia, there's many different types of dementia. But the most important thing is that Alzheimer's disease is a type of dementia where people get kind of confused. They use those words interchangeably a lot, like, oh, so-and-so has dementia, but it's like, okay, what type of dementia? And they're, oh, I didn't know there was different types. And so again, dementia broad term, and Alzheimer's disease is a type of dementia.
Now, with understanding the conditions here, what are some early signs? What are the earliest signs that people should look for?
So think about it as normal aging. As I said, we're going to have a occasional forgetting of names and appointments, but people remember them maybe later on or with help. And then maybe occasional errors with finances or completing complex tasks. Some people need, with normal aging, help with technology or learning something new, occasional word finding difficulties. Think about this, these difficulties are occasional. With kind of the early symptoms of Alzheimer's disease, now the memory problems are happening more frequently and they're actually disrupting people's lives. So they're forgetting, their bills. They are forgetting more common recipes that they had either easier to follow along or else they had previously memorized. They're forgetting how to complete daily tasks of driving familiar routes where they're like, I have to put in my GPS now, but I used to remember how to get to my daughter's place. In trouble following conversations. So now think about it as it's more disrupting the day-to-day living a little more.
Mm-hmm. And how is Alzheimer's diagnosed as well as other forms of dementia? How do you determine that, okay, this is something that as a patient that you're going to have to expect is coming next?
Great question. So I think about it as there's a lot of pieces to the puzzle. So we look at cognitive testing, which I do. We look at people's labs and even neuroimaging, like brain scans. Again, every piece is a piece of the puzzle. So for a patient or a family member, if they're concerned about memory, they'll probably bring it up to their primary care doctor or a neurologist. And the primary care doctor either will even do kind of a brief screening test. And most of these screening tests are 5 to 10 minutes long. And again, it's really brief cognitive screening. It's not diagnostic by any means, but it's kind of, okay, where are you at? Okay, you're within the normal range, or okay, there is more difficulties across the thinking. So we're going to refer you to neuropsychology. And with neuropsychology, we're going to do a more in-depth testing. So more paper and pencil testing. I think about it as more like schoolwork. So we're going to ask a lot of questions, have them remember things, but also look at their, as I said, language, name things, and see as best they can do things. And so that can kind of help us decide on, okay, is it normal aging? Because when we do this testing, it's actually going to compare their scores to other people their same age. Because I expect a 60-year-old to perform different than a 25-year-old or a 90-year-old. And so then that can help us decipher of, okay, is it normal aging or is there something more going on? And based on strengths and weaknesses in neuropsych testing, that can tell me what type of dementia maybe we're working with. So that's the cognitive testing portion. I also have people do lab work. So we all run our typical lab work, our metabolic kind of panel, but a lot of those metabolic panels don't include B12, TSH, which is your thyroid, and folate. So I will always look at people's lab work to make sure that those additional labs were also done, because if we're low, high, that can really affect our thinking as well. Another lab work, it's actually looking at the biomarkers. Recently, the FDA approved a new p-tau 217 test, which can measure the abnormal tau proteins in our blood, and that can be associated with Alzheimer's disease. Unfortunately, it is not covered by insurance, so it's going to cost $500, but that also can further help you decide of like, okay, are we really dealing with Alzheimer's disease? Another test that we could do is neuroimaging, so a head CT or a brain MRI. And so that can look at the structure of the brain. Importantly, it's not a 1-to-1 ratio. Just because our head CT or brain MRI comes back normal or unremarkable, the radiologists call it, doesn't mean that we're not going to have cognitive deficits as well. I've seen very good MRIs, very bad testing. I've seen it the other way around, where I've seen very bad MRIs, but very good testing. So again, it's not a 1-to-1 ratio, but it can help tell us of what's going on. Again, all these are pieces of the puzzle. Another last one that people ask about is genetic testing. So whether it be through 23andMe or Ancestry, you can get genetic testing for the APOE gene. Just because we have that genetic factor does not mean we are going to get Alzheimer's disease, but it indicates that there is an increased risk of having it. So again, cognitive testing, neuroimaging, labs, and genetic testing are all kind of pieces of the puzzle that kind of can help determine of, do we have Alzheimer's disease or what's going on cognitively?
This next question, I think back to other diseases like lung cancer. It's obvious that early detection means a lot there. In this context, what does early detection mean? Why is it important?
Yes, there's so many elderly that actually refuse to come and see me or refuse to actually comment about their memory difficulties because there's nothing we can do about it. Well, there's so many things we can do. So the earlier we can catch it, the better outcomes we have. So it is very helpful for treatment options, care planning, and just long-term quality of life. So if we can catch it early and kind of get, as I previously said, kind of that mild cognitive stage, it's kind of like the stage right before we technically meet criteria for dementia, there's medications that can slow down the progression. Yes, there's no cure for Alzheimer's disease, but there's medications that can slow down the progression. We also can look at kind of other reasons of why are these people having these memory problems. So we can address comorbid conditions like, okay, are we dealing with sleep apnea that's not treated? Are we looking at your medications that can really affect memory? Are we looking at, low vitamin B12 or low vitamin or low folate, low thyroid? So if we can detect these cognitive difficulties early, we can address things that are treatable, like sleep apnea or medication changes or adding just a supplement like B12. Also, it's so important to kind of get it detected earlier because we can make healthier decisions. Staying cognitively active, socially active, physically active. I actually see a handful of patients that really decline after they retire because they're not as active as they once used to be. So if we know we have these cognitive difficulties, then it kind of drives us to stay more active, whether it be cognitively, socially, or even physically. And then my last thing that I really like is help with family planning. So we hope for the best, but we do plan for the worst. So with Alzheimer's disease, it is progressive. And so we want to hope that we can slow down the progression, but we do want to plan to see, okay, at one point we won't be able to make our own decisions. So let's get a power of attorney in place. And so we can decide, our daughter, our son, family member is going to help make those decisions, whether it be, current legal decisions when we can't do it ourselves, financial decisions, or even long-term care. There might be a point where assisted living or nursing home might be better. Some people prefer to stay at home. So if you make those wishes sooner when you're cognitively cognizant, then that's going to be better in the outcome. So early detection is key for, again, treatment options, care planning, and just long-term quality of life.
How does Alzheimer's typically progress over time? I understand that that's a fairly involved question, but some of the basics on what you can expect, and I knowing that it's probably depends on the individual.
That is so true. It is a progressive disease, but it's different for every person. And so when patients come and see me, I see them for that point in time. I am like, I don't know how you were a year ago. I don't know how you were 5 years ago. I don't know how you're going to be in a year or 5 years. So when I see them, it's that point in time. I highly recommend they usually come back and see me in 6 to 12 months so we can redo the testing and kind of help inform the trajectory. Do we have only a mild decline? Do we have a moderate decline? And that can help us. However, there are things that can impact progression, such as age of onset. The earlier age of onset, the worse prognosis we have, the faster progression it is. So typically, normal age of Alzheimer's disease onset is going to be after age 65. If we see it before age 65, it's going to be considered like early onset compared to the age. And that's going to be a faster progression. If we have more onset cognitive difficulties at age 80, it's going to be a little slower progression versus somebody who was 55, 60. Also, I think about it as people's cognitive reserve. So it's kind of like they're functioning, their cognition prior to age of onset. If we have somebody who maybe struggled in school, maybe intellectually disabled a little bit, they're going to have more vulnerability to the cognitive changes versus somebody who is high cognitive reserve, whether they have a doctorate or whatnot, they're going to have that more kind of safeguard better for them, and they can deter the cognitive changes a little longer than somebody who has lower cognitive reserve. Other things that affect progression is medical history. If we have medical comorbidities, like any kind of cardiovascular risk factors, like heart failure, diabetes, high blood pressure, high cholesterol, and then we get into Parkinson's disease or sleep apnea, those things can affect our cognition within itself. So it can actually progress the Alzheimer's disease a little more. And then also, if we're not active, if we are just watching TV all day, every day, not staying socially, cognitively, or physically active, that really can impact the progression. As research has shown, if we do stay active, that can really deter, but also slow down the progression.
Without getting too sciencey here, what is going on in the brain when these things are manifesting themselves in your daily lives?
So as we get older, our brain shrinks. That's why we're going to have more cognitive difficulties. Think about it as especially our hippocampus. There are these two little parts of the brain that sit in the back, and that's where they store the memory. And so as we get older, they get smaller and smaller and smaller. So that's why we can't hold as much information as we used to. But with Alzheimer's disease, our brain shrinks a lot faster. And so then we're going to have more difficulties holding that information. And eventually it's going to even affect our whole brain. So we're going to have more difficulties, not with just memory, but with our language, attention, processing speed. And then that's when we're going to have more of those difficulties. So it's just kind of like your brain is shrinking just a little faster than we'd expect. You can see that. I'm not going to say all the time on a brain scan, such as an MRI, but sometimes we can. And that's why it's so important to have that piece of the puzzle. Be like, okay, let's look at the brain scan. Is it a little smaller, atrophied, we call it, more than somebody else we'd expect their same age? Now with the biomarkers, the blood tests and things like that, now we can look at like the tau proteins and things like that. I think that is another good way to kind of look at where how the brain changes as we get older and whether it's Alzheimer's disease or not. But our kind of go-to one more day-to-day is going to be that brain MRI and the shrinkage of the brain and seeing if we can see that that's shrinking.
How can a loved one distinguish between normal aging and something distinctive?
Yes, I would say most of the time it's going to be loved ones being concerned and saying, I think your memory is a little worse than it should be. And very, very rarely, but it does happen where patients will think about it as themselves. They're like, hey, I think I'm struggling a little more. But again, I'm kind of going to go back to, with normal aging, it's going to be more of that occasional forgetting. And maybe if you remind them or they can remember things later on, occasional errors, needing some help with technology, some extra help learning something new, occasional word finding difficulties. But when we are starting to, I'm repeating myself a lot to my mom, or I'm repeating a lot of stuff to my dad or my spouse. Now, we're kind of questioning that. Now also, my wife used to know the recipe and she didn't have to even remember the recipe. Now she's having difficulties remembering the recipe or even following the recipes. And we used to be able to drive. She used to be able to drive very easily around Bismarck, but now we're having more difficulties. And so now we're having more of these difficulties day to day. And that should be a little alarming where we do want to bring something up to the primary care doctor, to the neurologist and say, I'm a little more concerned about the memory. Should we get a little more evaluated?
And we alluded to this a little bit earlier with the importance of early detection. But what are some treatment options out there that are available right now, and what are the types of things that you can realistically accomplish in being part of these treatments?
Yeah, it's kind of part, as we said, the early detection. So medications, there's no cure for Alzheimer's disease, but the medications such as Aricept, Namenda, Exelon, they can slow down the progression. And so they kind of put more of this neurotransmitter, this more chemical in the brain to hopefully form those memories for people to slow down the progression, but also just making healthier decisions. Staying active is the biggest thing, staying socially, physically, cognitively active. A lot of people, as Alzheimer's disease progresses, it affects memory, but it also affects language. So they're going to have more word finding difficulties. And because they're having more word finding difficulties and potentially kind of following conversations because they're having more difficulties remembering conversations, they're going to start socially withdrawing. And so we really don't want them to do that because now we're not going to be using our language, not going to be using our brain as much. And so we can decline faster and faster and faster. So we really need to stay socially active, but also cognitively active. Sitting in front of the TV, watching rerun after rerun. My older men love Gunsmoke. And so I'm like, no, we can't keep watching that over and over and over and over again. We want to do stimulating things. We want to play board games, card games, jigsaw puzzles, watch game shows, Price is Right, Wheel of Fortune, Jeopardy. That's all going to be stimulating the brain. Reading is really helpful. But again, the worst we can do is just sit and watch TV. As there's just no interaction, we're not using kind of our brain because we've seen this episode a million times and we'll just keep watching it. So we really just have to stay active. And then also what we can do is it's called also disease modifying therapies. This is relatively new. Often people hear about Leqembi. It clears amyloid plaques with infusions. I reserve this kind of treatment for people who have it's early onset as I'm saying, kind of early before 65 and who have no medical history. So if we have a medical history of these cardiovascular risk factors like type 2 diabetes, high blood pressure, high cholesterol, stroke history, then you're even more likely to have this brain swelling and microbleeds. So the benefits don't outweigh the costs as of right now. But again, if we catch it super early onset, no significant medical history, then that's also an option. This is very promising. I think we're in the right direction, and hopefully in the next few years, 5-10 years, that this is going to be even way better as maybe even a kind of cure, but only time will tell. And then lastly is just, I talked about being physically, socially, cognitively active, eating healthy, and just getting good sleep. And also if we have there's a lot of people with sleep apnea. They don't like their CPAP, but the CPAP, I cannot stress enough, is so beneficial to our cognition, especially our memory. So if we have sleep apnea, every night that indicates that we're stopping breathing at night or we're snoring and something's blocking our airways. So we're not getting enough oxygen to the brain. And if we're not getting enough oxygen to the brain, it's going to cause cognitive difficulties, specifically memory. And so we really need to push that CPAP use if we have sleep apnea. I have seen where people have cognitive difficulties. They didn't know they had sleep apnea, didn't use their CPAP. They come back a year later after using their CPAP, they actually revert back to normal. So it does really impact our cognition, especially our memory. So things that we can do to kind of help with treatment options are memory medicine, staying physically, socially, cognitively active, eating healthy, getting a good sleep, use your CPAP. And as I said, there's also those disease modifying therapies like can be for certain populations.
And for sure, no more gun smoke then, you said.
No more Gunsmoke. Stop watching Gunsmoke. No,
Okay.
I know it's really great. My dad, that's my his favorite show. And I don't know how many times I tell people, stop watching Gunsmoke out of just joking. And they're like, but I love it. And I was like, oh, you do? Okay. But again, watching a show is fine. It's great. But it's just when we watch it all day, every day, that's when we have the problems, that we need to do something else to keep that brain engaged.
You've answered a lot of these questions that I have here that I was going to ask that you've already answered. But what do you wish more people understood about Alzheimer's and dementia? I think it's a great question because you're on the battlefield every day, and you see it from the challenges from your patients, but also the people around them and their challenges. And I think this one kind of speaks to the people around them. How should you view this if you have somebody like this in your life?
Many people think that as you get older, dementia is inevitable. Like you're just going to get dementia. And so I get that a lot because I ask people about their family history and they're like, well, she had dementia, but she was 102. Well, yep, you're going to have cognitive difficulties as you get older, but just because you're older, you're not going to get dementia. So yes, the true question is whether the difficulties go above and beyond the normal aging. And sometimes, yes, the cognitive screening tests, whether it be like a 30 question item or a 30-point evaluation, it just gets in of, okay, I'm giving this 30 question, or I should say 30-point questionnaire cognitive screening test at a 25-year-old, a 90-year-old, a 60-year-old, and you just get this one lump sum. With neuropsych testing, we really look in depth of what is going on, looking at your scores compared to other people your same age is like, okay, yep, you're 102-year-old grandma. This is normal aging. This is what we'd expect. You're going to forget things. But then the next person that comes in, I'm like, oh, this goes above and beyond. So there are things we can do and we can help decipher if it's normal aging or dementia. And then that's how we create these specific recommendations. The next thing is, okay, is it Alzheimer's disease or is it another type of dementia? And so if we can decipher that as well, the recommendations change as well. One of the other biggest things that I deal with is caregiver stress. It is so difficult being the caregiver for people who are progressively in the dementia phase. It is hard to be a caregiver. And so when people come in to see me, yes, I'm taking care of the patient, but I also take care of the family. And so I will ask, okay, how are you doing? Are we still able to take care of, dad at home? Okay, we're struggling. Do we need help? Do we need home health care? Do we need assisted living? Do we need something more than that? Then the next thing is, okay, now we have to talk about like medication, whether it be memory medicine, anxiety medicine, agitation medicine. While I do not prescribe medicine, I can kind of help people decipher like what medication would be good. And there are options because anxiety, depression, agitation can be common as the disease progresses. And so hallucinations, paranoia can also happen. So we want to manage the symptoms. And medication is helpful, but also behavioral techniques for the caregiver. It can be frustrating to be the caregiver. People will say, I've said the same thing 30 times today, and we lose patience. That is normal. That is common. And so we just have to remember that we are a person. We are human. So we are going to get frustrated. We are going to snap sometimes, or snap back, I should say. And so I'm really there for the caregivers on, okay, there's support groups for you. These are also, we have to remember that this is a brain disease. This is not them being on purpose of asking you the same question to be annoying. So we want to make sure that we don't argue with them. People with dementia are always right. Do not argue. They're always right. If their mom, who passed away 30 years ago, visited them yesterday, you say, oh, they did. What did you talk about? And so if we argue with them, they believe in their realm of life that their mother visited yesterday. And if you say that did not happen, you're going to argue with them. And then now you're getting them agitated. And then their cognition even gets worse. So it's this vicious cycle. So providing this caregiver support also during my appointments is really beneficial. Don't argue. They are right. If they're anxious about something, paranoid about something, we distract. And having all that for the caregiver is very helpful too. So these appointments, not just for the patient, but also the caregivers.
I think this is the last one here. What can communities do? We're painting with maybe a little bit broader brush here, but are there things that as a community that you can do to make this a little bit smoother ride?
That's a great question. So I think just being awareness, we all know about Alzheimer's disease, but it does look different for every person. Even dementia in general looks different for every person. So sometimes we have this preconceived notion of what Alzheimer's disease looks like or what dementia looks like. So we might not understand the person in the grocery store, why are they acting the way they are? So being just more aware of the different dementias or different ways that Alzheimer's disease can look, then we have just a better understanding of, okay, that's maybe we're dealing with dementia, or we don't get mad at somebody when they're maybe you're not remembering something on the phone, or if we see them at the grocery store that they kind of yelled at you, like, okay, maybe they're dealing something cognitively. But also I think Bismarck is doing, and I even think just North Dakota, United States in general, is doing a really great job of having more awareness with Alzheimer's disease, having the support groups. There's support groups everywhere, whether they be online, whether they be in town, whether they be at the senior center. And so there's tons of support groups. And so I think that's really helpful for the patients, but even the caregivers. And I do think that we are getting better and better with just more of the research and being knowledgeable of Alzheimer's disease in general as a whole. And I think that's kind of where we're going, is we're only going to get better, especially with the diagnosis, especially with the treatment. And I'm really happy of what we're looking forward and what kind of support we have. My number one go-to is the Alzheimer's Disease Association. There's such a bountiful information. They don't work with just people with Alzheimer's disease, but anybody with dementia. They'll come to your house. I can even put a referral in, or you can just call people from Alzheimer's Disease Association. And what we'll do is they will come to your house and be like, okay, what can we help you with? Is it home health care? Is it financial planning? Is it safety? What can we do and get you the right resources? And that's free of charge, which is really great. So I really push the Alzheimer's Disease Association. They're a great resource.
This episode is part of the Health and Wellness series by Sanford Health. For additional podcast series by Sanford Health, listen wherever you hear your favorite podcasts and on news.sanfordhealth.org.